Hi, I'm Isa DeWitty, and I am the co-founder of Ring 14 USA. And today I get to talk with Dr. Andrea Miele about her role in the clinic, the Neurogenetic Clinic at Children's Hospital of Colorado. And I want to emphasize that this is a collaborative initiative between Ring 14 USA, Project 8P, SLC 6A1 Connect, and STXBP1 Foundation. So all of us have joined together to provide multidisciplinary care to our children and their families with the idea that we really want to improve their care. And today I get to talk to a really important member of the team. And so I'm just going to let you, Andrea, can you just introduce yourself to our audience?
Sure. My name is Dr. Andrea Miele, and I'm a pediatric neuropsychologist at Children's Hospital Colorado.
Excellent. And so you said that you're a neuropsychologist, and so I'm just going to ask you to define what that means.
Sure. Yes. Kind of a big word. A neuropsychologist is a doctoral level and ideally board certified medical provider with extensive knowledge about how neurological, genetic, and medical conditions affect thinking skills.
Okay, so immediately I think, so what distinguishes you from a psychologist? And then also, what distinguishes you from the kind of psychologist that our families might encounter in the school setting?
Sure. Yes, we are different. A neuropsychologist is, again, primarily concerned with thinking skills, and we have training to be able to measure thinking skills using tasks that look at things like intellectual functioning, language, memory, attention, and other skills. Usually neuropsychologists, at least those practicing in medical settings, are not doing therapy,
Okay.
which is different. While we often work with school psychologists, we are concerned with functioning on a whole level, a whole day-to-day level, as opposed to just sort of functioning in the school setting. So that's something that distinguishes us, I think, from a school psychologist.
Okay, so how you're doing in the home as well as
right, home and day-to-day, right.
Okay. Well, so how do you fit in with the clinic itself?
Sure. So I actually have a little bit of a separate part. So my evaluations take place on the Thursday before the clinic, so the first Thursday. And this is a 3-hour appointment that consists of an interview, the testing portion, and feedback. In the interview, I'll ask about your child's medical history and ask you to tell me about any concerns that you might have. The testing portion is tailored to the developmental level of your child. So this means it could last anywhere from 20 minutes to 90 minutes, kind of depending on your kiddo. And that is conducted by myself and a testing technician or a psychometrist. A psychometrist is a master's level provider certified to administer our measures. In the testing portion, depending again on your child, we would love to have the child complete the testing in a separate room with myself and my tech, but we realize that that's not always possible. And so parents are obviously welcome to accompany their child for that portion, as long as they don't help with any answers. And then the feedback portion is where we'll go over the results and I'll tell you my recommendations.
Okay, so explain a little bit what the value is to the family in participating in this. So we're asking them to come in kind of a day early. So what's the opportunity? What's the motivation for them to do that?
Right. So I feel strongly that any child with a medical diagnosis should have a neuropsychological evaluation, but I realize that is my bias.
Okay.
But I do feel like there is immense value from completing an evaluation like this, because it really targets the strengths and areas for growth of your child. And this way we don't lose any ground where we could be implementing certain interventions or even targeting existing interventions to try to get the most of our time that we can, so that your child can reach their learning potential, because that is everyone's kind of shared goal.
So you're giving strategies back to the families.
Yes, so I'm able to take the neuropsych results and say, these abilities seem to be developing well, but here's some abilities that are not kind of developing at the same rate. So here's how, let's work on these. Let's talk about how we can work on them.
Okay.
And so how you can communicate, with therapists or school, specific things to work on.
Excellent. And what's the value to the foundations or to the clinic itself to do these assessments? How does it fit in there?
I think first and foremost, research. So this clinic has, being in academic medicine, we're all very interested and enjoy doing research. We feel it's integral to learning about how to help kids. Research, I think, also can change lives. And we've identified a lot of gaps in the literature from the groups that you had mentioned that are participating in this clinic. And so the value, there's an individual value of completing the evaluation, obviously, for your child, but then we can pool all the information together to help other families kind of experiencing the same questions.
So you're really kind of fleshing out kind of the range of abilities and everything when you assess all the children and painting kind of a better picture of the syndrome from a neurological and learning aspect.
Yes, right. Yep. Just like you said, we have neurology input, the genetic, we understand the genetics, and then we have information about cognition and much more.
Excellent. Excellent. So when I hear the word test, it kind of brings me back to high school and college and all of this. And I know in particular for our families whose children have real intellectual challenges, developmental challenges, that sometimes when we hear the word testing and assessment, like, it can be really heavy, and so I wonder if you could paint that in just a little bit more positive light,
Sure. Yes, and thank you for bringing that up. I try to refer to what I do, or at least on the day, as tasks instead of tests, because these are not like tests for school where we're trying to get 100%. In fact, I will tell you, and your child, that really all that we care about is that your child tries their best, because nobody answers every question that we have, and nobody answers every question correctly. It's impossible based on how the measures were developed. So we really want to kind of dispel that from the day. And I just want to know kind of how your child can do what they do. And I want to see where their ability falls. And so the evaluation might feel like it's very targeted to kind of uncover problems, but we're also looking at strengths. Those are a very important aspects of the evaluation as well, because I think that you're able to promote your child's development even more in the areas that are hard if we can supplement with things that are less hard. I think that really helps encourage skills to develop.
Well, from a personal note, I can say that Marie went in and did the assessments with you when we were in Colorado. And when I was reading your report, I was really touched by the fact that you led with how warm she was and what excellent eye contact she made. So in other words, you led with her strengths. And anyway, that was encouraging. So.
Yeah. Well, those are important, aspects as well, because any child working with a school or therapists, they want to know about those types of things that can help, kind of anything to support, further growth.
So my last question to you is, what do you love best about your job? What gets you up and gets you excited about participating in this clinic?
Thank you for asking that. I I will say, first of all, that one of the aspects that I just find very, very intellectually stimulating is just being with all of the other providers. It's an amazing experience to be able to be with neurology and genetics and rehab and our therapists and hear all these smart people bringing their ideas to the table so that we can help your child.
Mhm.
And I think that that is just kind of a testament to how much we care about these kids and how we want to work together. And we feel that working together is the way that we can provide the best care. So I find that to be, I feel very fortunate to be part of the group because of that aspect. And then the other part that I love is just working with each child and helping their family. Often families already know the diagnosis when they come to me, but there's some more unknowns about what it's going to look like in terms of day-to-day and school. Families are initiating therapies, and I enjoy being able to help guide and come up with kind of short-term goals, long-term goals, come up with a plan. My favorite thing is when I feel like I have understood the child and the family can leave with a plan. I hope that that reduces some anxiety in what might be an overwhelming time.
I love that answer. That's great. And you also just gave a wonderful plug for this multidisciplinary aspect of this clinic. And it's something that I just want to emphasize that the whole team at Colorado is talking about your child and really coming up with holistic plans with all of the challenges. They're all communicating as a team, and I think that there is great benefit in that. So clinic meets the first Friday of each month, and to get to take advantage of the special opportunity of meeting Andrea and going through this neuropsychologist assessment, then we'll ask you to come in on Thursday. So I hope that you will plan for that. I hope that we've shown that this is of value to you and to your family. And I'm just going to close by thanking Andrea not only for her time today talking with us and kind of explaining this process, but also just her role in the clinic, and really appreciate the warmth and dedication that she brings to her job.